Thank you. Good morning, everyone, and thank you for your patience. We just had a few technical issues there, but we're back online now. So welcome to this morning's EAP Active Communities. And we'll kick off with apologies for absence.
Chair, apologies for absence from Councillors Mercer, Harrington and Shacklock, and also from Officer Yvonne Coleman-Thomas.
Thank you very much. Are there any declarations of interest? No? Lovely. Thank you. Sorry, Councillor. Could you put your mic on, please? Thank you very much.
Something's just occurred to me. I've been asked to be a trustee at a Citizens Advice Bureau.
Yeah, I don't think that would... I'm not sure.
Saying
no.
it because
yes.
It's early days and I don't want to tiptoe into...
No, okay, great. We can make a note of that, I think, yes, for future reference, if you're happy with that. Thank you very much. Moving on, the minutes of the meeting held on the 4th of October 2024. Do I have any comments or queries on accuracy at all? If not, are you happy for me to sign the minutes? Thank you. If I can find a pen, that would be useful. There we go. Happy? Yes, sir.
Chair, I have no problems with the minutes, but we have agreed at this committee more than one occasion that we would have some sort of action sheet or outcome sheet. And I think we've had it once, we made an attempt at it, but we haven't had anything since that.
Oh, right, okay. Can we make that an action, please, Pauline? Thank you very... Yeah, lovely. Thank you for bringing that up. We will put that down as an agenda item then. Maybe we should look at that each time we come to these meetings then. Thank you. And you're happy for me to sign the minutes? Thank you very much. Wow, 29th already. Thank you. Right, moving on to the substantive items. So the first item on the agenda, I think it's is the North Northampton Council Active Community Strategy for 2024 through to 2029. And I'd like to introduce Kerry Pennell, who's going to lead us through the presentation. Thank you.
Thank you, Chair. I'd also like to introduce the colleagues that I have with me today. So Julie Cardwell, Head of Leisure Services, and Kirsty Winder. Do you just want to say who you are, Kirsty? Thank you.
Hi everybody, I'm Kirsty Winders, I'm Director at Max Associates, who's been supporting the Council in delivering the Active Communities Framework.
Thanks, Kirsty. The screen's gone blank. Right, okay. So members will remember, because we brought something to the EAP probably, I want to say this time last year or slightly earlier, when we were in the consultation phase for the Active Community Strategy. The Active Community Strategy forms part of a wider strategic framework for active communities, which we've been working on with Max Associates over the last year or so. And that includes the Active Communities Strategy, which we're going to talk about today as the overarching strategy, but also includes the Leisure Facility Strategy and Playing Pitch Strategy, both of which are nearing completion. We were hoping to be able to discuss all three at this EAP, but we haven't quite got both of the other strategies over the line yet, partly because the technical methodology that is required to get those done, because they are planning documents under the planning framework, is quite detailed and robust and requires lots of engagement, lots of different people, including the national governing bodies of a whole range of sports, and we haven't quite got all the feedback and the sign-off that we need yet. But they are due to be completed very soon, and then obviously we will be sharing those and happy. I don't know quite whether the EAP timelines will work around those, but if we want to have a meeting that discusses those, then we obviously can. So the focus today is on the Active Community Strategy. I'm going to run through the slides. I think you've had a copy of the draft strategy as well, which obviously gives more detail. The summary slides pull out the salient points, and then if we've got any questions, either Julie or Kirsty or myself will be able to help with those, hopefully. So the first slide just points out the methodology, and again we covered some of this at the EAP last year when we discussed the consultation phase, but it has involved a review of a whole range of strategies that feed into active communities, nationally and local strategic priorities. And I think that's really, really helpful to set the context. There's been a lot of desktop analysis of data, with particular emphasis on the profiles that are created for the local area partnerships, the 7 areas, which really goes into granular detail at a neighbourhood level, but also looking at current rates of participation in physical activity, which we get from the Active Lives survey, which is a national tool run by the government. It's not as robust as we would necessarily like, because it is a small sample, but it is the only sort of national tool we have of measuring physical activity levels, other than what we did through our own engagement and surveys. We've got some information in the strategy about who we see as inactive at the moment in North Northants and the barriers to that, and we'll cover that in the slides. There was a whole raft of engagement, and members obviously were involved in that last year. We did a whole range of focus groups and one-to-ones, and also a range of surveys, which we'll cover. And then there was a review which feeds into the leisure facility strategy of the existing facility provision in North Northants. Now, the leisure facility strategy is what's going to focus much more on that. So the active community strategy references it, but doesn't go into any detail. We've looked at some best practice that's already going on across the area. And then obviously critically, it's the so what. So we've got a strategic set of high-level outcomes and priorities, and we're in the process now of pulling together detailed action plans that sit beneath those priorities, and that's part of the discussion we want to have today, and how we measure that going forward. So that slide there just gives you a summary of the strategic framework, as I've mentioned, and that I think you'll see from the next slide. The important thing to say is that this is an active community strategy and framework for North Northamptonshire. The council is the enabler in this, and we are leading the work, but we are not the only delivery partner, because it's important that the whole system comes together to help us deliver this. So the next slide pulls that out in a little bit more detail. It summarises the purpose of the strategy, which is about creating cohesive communities where everyone can live active, healthy, happy and connected lives. That's the council's vision, and the purpose of the strategy is how we deliver against that to enable active lifestyles for people who live, work and visit North Northamptonshire. And the diagram, which comes from Uniting the Movement, which is a national physical activity strategy. The little egg on the left-hand side really emphasises the fact that we have to look at this as a whole system. We need to do what we can to break down the barriers for individuals to be more active, but we also have to recognise that that is influenced by the wider socio-economic factors and where people live and the lifestyles that they're living. It's influenced by organisations and institutions, so the policies that the council has, but also the policies and procedures that our partners have, by the physical environment. So what are we doing to make sure that physical activity is the easy choice for everybody in every day of their lives? And then at a wider, local policy, but also national policy affects that as well. And so we recognise, therefore, that, as I said earlier, that whilst this is being driven by North Northants Council, the strategy and the actions that fall beneath it are very much part of the whole system, and we need to make sure that we've engaged with lots of different people, not just in terms of getting to this point, but also in how we deliver the strategy. And some of the sort of key partners in that are emphasised there. So it's about the council, but it's as a facilitator, but it's also about the NHS and our healthcare providers. It's about sports clubs, it's about schools, it's about private businesses, the voluntary and community sector, and we all need to work out how we play a part in delivering this strategy. So the strategic review, the document itself, the draft strategy, goes into much more detail, but you'll see that a whole raft of documents were looked at to feed into the active community strategy. So all the sort of corporate priorities for Northants Council, but also wider than that in terms of looking at, for example, the Live Your Best Life strategy for the integrated care system, which is obviously looking as a partnership, as a system, how we can improve the health and well-being of our population, and keeping active is a really key part of that. I've touched on the demographic analysis, so the strategy goes into quite a lot of detail, and also you'll see, if you've read it, the way it's set out is after describing the sort of data and analysis, there's then a sort of summary table or box or visual part of the strategy that tries to pull together the key highlights from the different analysis. And so what we see is that the higher levels, our areas with higher levels of deprivation do have an impact on inactivity levels. So not unsurprisingly then, our most deprived neighbourhoods, Kingswood and Hazelheath and Corby, Avondale, Grange and Kettering, Queensway and Wellingborough, that are obviously identified as some of our most deprived neighbourhoods. Also, that's where we see higher inactivity levels. But we also have to recognise that inactivity isn't just linked to deprivation. We have to recognise our rural areas as well, and sometimes it's down to opportunities or transport networks for our rural communities to take up the opportunities to be active. And it also links to demographics. So we have higher levels of inactivity for our older people over 65, and then in some of our more inclusion groups, so our ethnic minority communities, disabled people, and in some cases women and girls. So understanding who is inactive. So this slide again tries to map that in terms of the geography and shows the highest levels of inactivity against the map of North Northants, but also gives a summary of the barriers around understanding why people are inactive. And we got a lot of this data and intelligence from the surveys that were done with residents and with people who use facilities, but also with different sections of the population, such as younger and older people. So again, I wouldn't imagine there's anything here that's unsurprising, but some of the barriers to physical inactivity relate to cost, and it being whether something is affordable, accessible facilities. That might be about distance to travel, but it also might be about whether people feel they meet their individual needs. Time, a lot of people say they just can't fit it into their busy lives. And then also whether people have long-term health conditions has an impact, even though we know that actually even with a long-term health condition, if you do a little bit or any physical activity that you can do, it will have a benefit effect. That is one of the reasons that people cited. And I think one of the things I wanted to really emphasise that I think it was comforting from the work that was undertaken that people do understand the benefits of physical activity, because sometimes we think, is there an education piece here to do? Because people don't actually understand the benefits. I think with all the media and everything around, I think people do understand the benefits, but translating, I know it's better for me if I'm active, to being active can be a challenge, particularly for some parts of our community. So in terms of the sort of summary, and this is extracted directly from the strategy, what current inactivity levels and how does this influence what we might do as a result of the strategy. So we need to focus on areas of greatest need, whether that's our more deprived areas where inequalities are higher, but also our seldom reached or our hardly reached groups. We need to make sure that what we do adapts to the different demographics and age ranges within our population, because it is definitely not a one-size-fits-all. We need to make sure that we recognise that physical activity, and we keep saying physical activity and not sport and leisure, because physical activity isn't directly or doesn't have to be directly linked to what is delivered in leisure centres or leisure facilities or by sports clubs. It's taking the much broader view and thinking about how we deliver outreach into our communities, use our green spaces, our wonderful open spaces and networks, and the whole plethora of community facilities that exist. Whoever's running them, our community centres, our village halls, our pavilions and our pitches, all of that need to be used, and we need to make sure that people know that they're there, that they can be used, and that we enable as a council. We won't deliver all of this ourselves, obviously, but that we enable and do what we can to support that delivery out in our communities. The top 3 most deprived deciles are underrepresented in our leisure centres, so whilst we have seen a pretty good recovery in the post-COVID world in use of our leisure centres, particularly our in-house leisure centres have recovered really well, we know that we're not necessarily reaching all the people that actually would be best to reach in our leisure centre offer, so we need to think about what else we can do there to attract those people in and to keep them, to make sure that it's affordable and accessible. Interestingly, the cleanliness, quality and accessibility of facilities came out very, very high on people's agenda as a reason why they do or why they don't use facilities, and so standard of venues is obviously really important. Movement needs to be built into everyday life. So as I said earlier, it isn't just about saying to people, you know, people think, oh, you say I need to be active, I need to go to the gym, I need to put my Lycra on, and that's not for me. It's not about that at all necessarily. For some people it is, but it's about how we can encourage people to do stuff that raises their heart rate, basically. We need to think about busy lifestyles and how the offer, not, as I say, this isn't just about the council's offer, but the offer in the round can work around people's busy lives and their work and school and caring, etc. commitments. And we need to do this with our communities and not to our communities. That's really important. So I'll come on to some other work that we're doing that we've had some funding for, but that gives us an opportunity to really work with communities to work out what will work best in certain places and for certain people to try and get people more active. So the next slide just gives a summary of all the stakeholder engagement that was done, as I said earlier, through either individual sessions or through surveys, and that was a comprehensive and an important piece of work, and it was partly about promoting the strategy, obviously, but also asking what people saw the future of leisure was, and as I've said earlier, people now recognise there's a real shift from leisure and sport into more active communities, but also recognise things like making sure that services are place-based, that we make sure our environments promote activity or encourage activity, that we think about healthy workforces in employment spaces, and also that we think about that education message about the importance of activity to people's overall health and well-being, and that it can actually improve people's health and well-being, not even if they're suffering with long-term conditions or other diagnosed conditions. Community engagement focused a little bit more on people's current activity levels and also why people are active or why people, more importantly, aren't active. So it's a slightly different emphasis in the community-based strategy. 21% of people that returned the survey said that they were, on average, active more than 30 minutes a week, which is the Sport England defined levels of activity. I think that, without checking, Kirsty might be able to answer this in a minute, how that compares with the Active Life survey, but significantly 91% of respondents said they'd like to do more physical activity, which is really encouraging. I mean, maybe if you get asked that, people are more inclined to say yes than no, but it is encouraging that there's some demand out there that we need to tap into and that we need to encourage and support people to be more active. And the main reasons that people do recognise it's good for their physical and mental health, but again, the barriers were echoed that I've said earlier, that those barriers came through. And for children in particular, I think that's quite an important one, that cost is important for families, but also the real proximity to people, where people live around facilities. Swimming is still the key activity. Swimming is the activity that most people would like to do more of, followed by using the gym. And then we did also ask people what their current usage is of the facilities that we have in Northants, and the strategy goes into that in a little bit more detail. But it was interesting that people didn't just think about leisure centres and swimming pools in that, they did think about the wider open space offer, which is positive. So this is just a sort of flavour of some very detailed information that will be in the leisure facilities strategy, which goes into a lot of detail about mapping and showing what we have where currently in Northamptonshire. And then obviously, I mean, you'll see that in due course, but it then sort of really delves into where they are and accessibility, etc., and looks at how whether the current facilities that we have meet the population's needs now, but also projects what they are and what will be needed by 2041. So this is just sort of reference because it was part of the initial work that was done to inform the strategy. But as I say, more detail will be in the leisure facility strategy to come very soon, hopefully. So there's quite a number of best practice studies in the actual strategy itself. So we've just picked out one here. So hopefully members will be familiar with the Get Up and Go programme, which is partly funded by the Council through Public Health, but also through the Integrated Care System, and also receives funding from other places as well. And it is about an activity programme for our older and more frail population in a safe space, and it is coordinated by Northamptonshire Sport, and there are lots of different programmes and activities that happen every week across lots of different locations, and we're all behind trying to expand that even further as we move forward. And so there's a case study and others in the strategy. So what do we need to do to actually bring this strategy to life? So there are a number of critical success factors that have been identified. So I've mentioned a couple of them already. One about making sure that we take a place-based approach, that things need to be geographically tailored to the needs of our communities, that we collaborate. This is not just about the council. Partnership working with our stakeholders and our communities is critical, that we put people and our communities at the heart of what we do, and that we co-produce and co-design, and that we listen and we engage is really, really important, because otherwise, you know, we can. It's not a case of, I think Sport England used to think, if we build it, they will come. Well, I think we know now that's not quite the case, and we need to work with communities to understand what will help them to be more active. And we need to obviously monitor what we deliver against the outcomes that we've set, and we need to make sure that what we do is financially and environmentally sustainable. And then the Active Communities Partnership, which I'm going to come on to in a minute, is a really important enabler in this, because this isn't just about the council, as I've said. And so we had a steering group that was set up that was had some partners involved, but it was mainly council officers to get the strategies to this point. And we've now developed that steering group into a strategic Active Communities Partnership with representation across the system. It's being chaired by Chris Holmes, who's the Chief Executive of Northamptonshire Sport, and it involves obviously a range of council departments, but importantly it also includes our leisure providers, representatives of the national governing bodies where appropriate, and also health colleagues, so that we can take a real collaborative approach to the delivery of this strategy. And the voluntary sector involved in that as well, importantly. So that just summarises the purpose of the Active Communities Partnership, and it is to have a strategic overview of the delivery of the strategy. It's also to recognise that the Health and Wellbeing Strategy, which is going to the Health and Wellbeing Board in December, but which has been developed iteratively over the last 6 to 12 months. One of the 5 strategic priorities in that strategy is keeping active, and so the Active Communities Partnership will also have oversight of the work to deliver on that priority for the Health and Wellbeing Board, because clearly there's an absolute overlap. Okay, and then I won't go into details. There's quite detailed terms of reference. I've just given you a flavour of some of the things that that partnership wants to do. There shouldn't be any surprises in there. And then I just wanted to mention, before we come on to the outcomes we're trying to achieve, the Sport England Place Partnership Programme. So quite recently, or over the last sort of 6 months, the Northamptonshire has been working to submit a bid to the new Sport England Place Partnership Programme. So Sport England, over the last 5 years, took a slightly different track to the way it invests in communities. and has taken much more of a place-based approach, recognising that we should target our activity in our most inactive areas, which often are aligned to areas of deprivation. They piloted 12 national pilots or place pilots across the country between 2018 and 23. And now, as a result of the learning from those, have now rolled that out to considerably more areas across the country. So Northamptonshire is one of those, and we were invited to apply to take part in the programme for 4 areas across Northamptonshire, 3 of which are in the north and 1 is in the west. So the 3 areas in the north are Kingswood in Corby, Lodge Park in Corby, and Queensway in Wellingborough. And the idea with those is to really take a bottom-up, community-led approach so that we really understand what the barriers are and we work with communities. So we submitted a development award, so we've got money for the first 2 years of the programme, which is to get things up and running, to bring in some additional capacity, to help us if we need to do any more insight or engagement work with communities, which we do, and then on the back of that we'll be able to bid for even more funding to be able to deliver, hopefully, some significant and programmes that will have impact and also bring legacy to the area. So those slides just summarise some of that I've said, and that sort of gives an indication of we had just over £300,000 so far, and what it's allowing us to do, for example, is the work's been led by N-Sport, but we're working very closely with them, and we've got funding into North Northampton to bring in another place lead or a place lead into the leisure service that will be able to focus alongside of the place leads that already are employed by N-Sport on our areas, so particularly Corby and Wellingborough. And it's also important to note that we really want to see a ripple effect from that work. So we don't, whilst it is defined and we have to spend the money in those areas, we want to learn and be able to see how can we spread the impact wider than just in those 3 neighbourhoods. So I'm nearly there. So you'll see from the strategy that there's an overarching framework for outcomes and high-level sort of priority actions, and that's laid out in that table. So we've split the outcomes into 4 main themes: healthy communities, so improving health and well-being through the development and delivery of opportunities to increase participation in physical activity and movement. Connected communities, so making sure that we're connecting people through physical activity and movement in communities, so building that community resilience and sense of place. That we are thriving communities, which is about making sure that our workforce in particular, and I mean that in the round because that can be obviously people who work in leisure services, but it can be health colleagues, and it can be voluntary sector, and it can be volunteers, absolutely. Anybody that's working in the physical activity arena is equipped and supported to deliver what we're trying to do about increasing activity amongst our population. And then green communities, which has a particular focus on active travel and working with our colleagues in planning and with our delivery of the Greenway strategy and the LC WIPs, for example, about how we can use our infrastructure to get people walking and cycling more and getting to work other than by car, basically. The second bit of the table just starts to pull out some of the things that the partnership has identified so far about what we want to achieve and how we might do that. And we're now, as I say, working on some detailed action plans and KPIs that will sit beneath that. And the next slide just gives an example of some of the performance indicators that we would want to be looking at. This is an ongoing piece of work. We didn't want to just sit in a room and come up with KPIs and come up with activities. We want that partnership approach to co-produce that so that it's owned across the system. So obviously happy to take questions on anything that you've read or anything that I've said, but we did want to ask a few questions of you as well, or pose a few things into the room. That slide just summarises the 4 priorities. As we develop our action plans, is there anything that you think that as a council, either in terms of our delivery or as our enabling function, are there any activities that you would like to see us try to ensure happens? And particularly thinking about what you know about your local communities, you know, how do we best engage and support residents to be more active? Do you know of something that works really well already? And it's about the geographic communities, but also about more targeted communities as well, those that are generally more inactive. So, Chair, I will shut up there. It's a bit of a whistle-stop tour of what has been a long and protracted piece of work, but happy to take questions, comments, feedback.
Thank you. Yes, thank you, Kerry. As you say, yes, it has been a very, very long and intense piece of work, and I think we've managed to gain an awful lot of information from producing this strategy, and as we continue to move and carry on with the facility strategy and the play and pitch strategy, they will all fit sort of hand in glove and provide us with the information that we need to continue the good work that the team are doing. And they are doing a fantastic job already, but obviously we need to be a bit more targeted, and I think this will help us to do that. So I'm going to open it up to the floor. I see Councillor Marks, you have a question.
Yes, thank you, Madam Chairman. It is a very serious problem that we face. It was brought home to me over the last few years by various people in my own ward and others saying that they couldn't get into town. And these were people younger and supposedly healthier than me. And what they meant by they couldn't get into town is that a walk of 20 minutes was too much for them. And once you lose the capacity to do that, you've cut yourself off from employment, you've cut yourself off from everything. You know, I can speak from personal experience as I have COPD myself, and I've been told if I don't walk a lot, I'll lose the capacity to do that, and it'd be very hard to get that capacity back. So it's a question, I think, of trying to get people before they're in the position of saying, oh, I can't go into town, it's 20 minutes walk away, I can't do it. Because it's very hard to bring people back once they're in that position.
You're absolutely right. Thank you. Do you want to come back? Anybody on that one, Kerry? Oh, excuse me.
And I think I'd just pick up on your point about it. It's about being preventative as much as we can. You know, we want to get people who aren't active more active, but we recognise for some people that's quite challenging, which is why there's not a one-size-fits-all approach. So if we can, for example, one of the things I'm keen on is, and we've started to do it through our Active Families programme, is trying to just, make sure that young people have, at a very young age, have physical literacy, that we build in activity into their lives, that they get the opportunity to be active with their parents or their grandparents or their wider family. So it becomes the norm, so that we have less people as they get into slightly older age in that position where for them it's just like, I don't think I can ever do this again. But for people who do feel like that, we also need to provide opportunities to say, actually you can, we just need to do it in the right way that's supportive, and that's why the Get Up and Go programme is really, really helpful, because that's not asking people to walk for 20 minutes, it's asking them to do seated movement at times or really gentle exercise in a safe environment, and also giving them social connection as well. So thank you.
Yeah, thank you, Kerry. Yeah, it's the social part of it actually is really important as well. When people feel isolated and they don't have anyone to talk to, then there's no one to encourage them to go out and be active. So that I think that social part of it is really, really important. So thank you.
Sorry, Chair.
Carry on.
So did you? I mean, I don't know with our our Wellbeing Walks programme, we probably have, although that is a walks programme, I think we have seen people who haven't been out of their house for 3 years. We've got a wonderful video, actually, that we perhaps share the link to members that we showed at the Active Communities Awards last week around the Walks programme. And there's people there who might well have fitted into that category, who just never thought they could and hadn't been out for 2 or 3 years, whether that's physical or mental health, and yet now are walking weekly as part of a group. So we have to tell people you can.
Yeah, absolutely. Yes, it was a fantastic video. The team did a really good job there, and we've got some people there talking about their experiences of how they've joined the wellbeing walks, and they've not been out of the house. I think one chap was not been out of the house for literally sort of 2 or 3 years or something like that, and then started. But I think the encouragement from everybody in the group helped also, and our officers are sort of there to encourage everybody, and it provides a space where nobody is judged. Everybody can just come along and everybody supports each other, and that's through the encouragement from the officers. So they get everybody together and they talk to everybody and ensure that everyone feels welcome. And I think that's part of it as well, making people feel welcome when they do start to take that journey, because the moment you don't feel welcome, that's when the barriers start coming up and you just don't bother going. So that's one of the key priorities, isn't it, as well, Julie?
Yeah, I mean, the Wellbeing Walks programme has been really successful. Only started earlier this year, but we've seen some amazing results. And as Helen said, we've done this video now, which identifies one person in particular, but there's other people that we could have, included in that video. There's a lady that's not been out of her house for 3 years, came along to a walk, and now is doing her shopping on her own. She's going on the bus on a weekly basis to get her shopping. She's not done that for 3 years. So that's a key programme. We've also got another one, which is an activity buddy programme as well. So we're trying to address people's isolation, lack of confidence to join in with physical activity. And that buddy programme gives an opportunity for somebody to give maybe somebody a phone call, maybe have a chat with them, meet with them, just encourage them to come out of the house and just be active. And whatever that is, so it's an individual basis how it's done. It's not one size fits all, as we've said. So yeah, so it's treating everybody individually. Yeah.
Thank you, Julie. Did anybody else? Sorry, Councillor McGee. Thank you.
Thank you, Chair. Firstly, congratulations. That's an excellent document. A lot of information in there, a lot of good stuff. And I think we've got to congratulate all the good stuff it's doing. We've still got some way to go in areas, but a lot of good stuff. And congratulations to all those staff that participate in that and brought this document together. I'll start with the questions you've asked us. You mentioned, in one of the pages there, it mentions about the hard-to-reach groups, etc. I didn't see anything on our looked after children who sometimes struggle. Maybe that's in another document. I would like to see them involved in that. I know at one time we were talking about a leisure card that was more affordable for looked after children, etc., so they could get more active and do more stuff. You talked about our own areas. I know in my own area in Kingswood we've had a lot of good support in Northamptonshire Sport. But I think that's coming to an end and they're struggling to keep that going. And it's about that sustainability and not falling back again. So I wonder if we could be talking to them about how we make that sustainable and keep it there in one of our most deprived areas. And talking about the deprived areas, we went to Kettering, didn't we? It was at the Grange area where we were in that community centre. And that community centre has got an excellent big 5-a-side pitch before it all. I go over there, that area, for personal reasons, family reasons. I very seldom ever see that in use, and that's a great shame, isn't it? If we want to do place-based stuff, we've got to make more use of what's there. And perhaps we can have a word with how that's run and who runs it. Chair, that was the questions that you asked me. I do have some other questions, if that's okay, about the
Thank you. Shall we let Kerry answer those questions to start, and then I'll come to you, David. Thank you.
I mean, I think your point about looked after children as one of our more excluded groups, and I know we have had conversations with Children's Services about how we might be able to support that accessibility moving forward. Just on the Kingswood sustainability piece, so because of the Sport England programme and the additional resource that's coming in, that will be continued. So that's going to be continued for at least another sort of 4 or 5 years, so that's really positive. And you're absolutely right. We know that we have some excellent facilities. We have some that need a bit of investment. We have some excellent facilities, but none of them necessarily are used to capacity, and that's part of the challenge. Is that how can we make sure that that's done? One of the big things that you'll see, I think it's in the leisure facility strategy rather than the active community strategy, is that we obviously have really good school sports facilities in the area, not all of which are available for the community, and that is quite a challenge, and it's a shame, and we need to try and break down some of those barriers as well. Thank you.
Absolutely, and on, if I may, Chair, on the schools, it's a great shame that they're not part of local authority, so that wouldn't have been a problem, but we won't go into that now.
Okay, let's not, thank you.
let's not go into that now. That's a whole new debate.
Thank you, Kat. Did you want to continue your questions before I move on? Is that fine?
If I may, please.
Yes, indeed. Thank you very much.
I had something, I mean, it's stated right through this document and the national documents that if we really want to improve our statistics of obesity, ill health, living longer, then we target the areas of most deprived and the rural areas in cases. And I know that, you know, national government is saying we should do that, and you're talking about a programme that's doing that. I would really like to because in my nearly 28, 29 years, the statistics don't change a lot over these times. And it's really very frustrating that, you know, the lifespan of people in Corby is a lot different to Oundle up the road, etc. And it doesn't change. How do we ensure that that does change? And it's a big question, I know that, because we've been trying since I've been involved. But how do we measure that and then say we will change that? Because areas of deprivation don't want to be areas of deprivation forever. The idea is to move them up so they're not, and they come out of that bottom quartile and people have better quality of life, etc. And that's what we want to do. I've not seen it happen in my lifespan, unfortunately. It's still the same areas, and so we need to change something to make that change, don't we? How are we going to do that, please?
Kirsty might well come in from her work across the country, but I mean you're absolutely right, and I know through the work of the local area partnerships where we're obviously looking at the data a lot around deprivation, and there is frustration that, you know, there's lots of stuff been done, positive stuff, but it doesn't always shift the dial on that data. I think we're acutely conscious of that. I think what we want to do moving forwards, and particularly with the Sport England investment in the 3 places, is, you know, we have to say, well, what do we do differently? And I know from the Sport England work when it was piloted, because I was involved in one of the previous pilots elsewhere, you know, we have to. What we're often guilty of is sort of parachuting things in, aren't we? We'll go in, we'll do this, and then the money runs out and we come out again. And whilst there might be, obviously, this positive impact while it's happening, that's great. How do you ensure sustainability? And I know, for example, you know, working with N-Sport for quite a number of years, you know, the approach they've taken in targeted communities, so Kingswood being one of them, is that you need to be on the ground, long-term, building those trusted relationships with local people, because, you know, that doesn't happen overnight. It can take a year before people are even happy to sort of get into that conversation about how they might change their lifestyle in a positive way. And there are generational issues as well in some of our deprived communities. And so, you know, we do need to think really differently. We need to think about our broad offer, and that's the balance between making sure that everybody in North Northamptonshire has the opportunity in the right way for them. So, and then we also need to think about those targeted communities where we need to shift the dial on the data and help sustainable behaviour change. And the two, they go hand in hand, but they're different, and we need to be really conscious of that. And we keep pushing that when we're talking to partners about what we might do differently. I don't know whether you've got any nuggets, Kirsty.
I don't know. Well, I think just for, I suppose, for measuring, the success of the strategy. Yes, there are those overarching statistics. You know, Active Lives survey that gives us data at a national level, which you're right, rarely changes or has rarely changed recently. I think what will be important is part of those KPIs that are going to be monitored are very locally focused. So even though those big stats might not change, at a local level you can really measure the success. And that might not always be a stat. It might be, we've talked about doing surveys at the end of every initiative or programme and getting that qualitative feedback from people, because just, you know, you can't measure somebody's mental health improvement like that. So I think it's getting that balance between quantitative and qualitative measures at a local level that will demonstrate the impact it's having within North Northamptonshire, even though the overarching stats might not change significantly.
And the only other thing I would say, and being part of the Sport England place-based programme gives us that opportunity, because there's lots of, what's the word I'm after? It's gone out of my head. Bringing people together so that we can learn from all the other areas. So there's the pilot areas we can learn from, but also with the rollout, we're all sort of regionally clustered. So because you want to, it's got to be tailored to a local area, but you don't want to reinvent the wheel, because somebody will have somewhere else will have grappled with it, and we absolutely need to learn. And I know from some of the stuff we've seen presented to us by Sport England, that there has been some real shift in some challenging communities, and we want to learn from that.
Definitely do.
Yeah.
Thank you. Are you happy with that, John?
Can I ask one more and then I'll
Yes, all right, thank
I've got
you.
pages of questions.
And then
but
we'll
a
let
lot of them
others have a
been
go.
answered.
Thanks.
You talked about the measuring of that, and it's very important, I believe, to actually break that down into the LAP areas or even estates, the areas of deprivation, etc., and get that information. How will that be reported back? How often and to who?
It is a good question. So, I mean, to be fair, we're happy to collate. We need to monitor what we're doing, both for the strategy and for the keeping active priority for the health and wellbeing strategy and for the Sport England programme. So there's going to be lots of metrics at different levels produced. So I'm more than happy to work out how we want to bring that forward. We can do regular member briefings. We can whatever ways.
In my opinion, it should go to health scrutiny.
Right. Okay.
Who should be looking after that? In my humble opinion.
Okay, I'm sure we can ask.
I can pick that up with the Director of Public Health and see whether that's appropriate. Obviously, probably because there's a health and wellbeing keeping active priority, but equally more informally, happy to share progress as well.
Yeah, and I think it would be useful to bring sort of regular updates to these EAPs as well, because obviously I'm sure with great interest. So thank you for your questions, John. Appreciate it. David, I think you were next. Thank you, and then I'll come to you, Russell, if that's all right. Thank you.
Thank you. It was a response to Councillor McGee as well. So I think it's always difficult when you're developing strategies, but your suggestion around things like the leisure card for care leavers is something that is being discussed within Corporate Parenting Board. I think Councillor Addison's rep on there. So, but what I will do is I will pass that feedback to Charisse, our DCS, just so that she's picking up on that. The other place where we may want to report on the effectiveness of this active communities sort of strategy is Health and Wellbeing Board as well, because we do tend to focus on the health bit rather than the wellbeing bit of our Health and Wellbeing Board. So bringing additional things in there and thinking about how that's benefiting the NHS, I think, is really important, because whilst we may be investing in, for example, leisure and active communities, there has to be a question about billions of pounds going into the NHS, and could it be better spent supporting our communities to be more active as well?
Yeah, if you bear with me, I think Shirley wants to come in on that one as well. So thank you. Sorry to delay you, Russell.
Thank you, Chair. Yes, David, and through the through the health and wellbeing strategy, the draft strategy, the keeping active strand would be a really good place to bring that through, because I know Julie's leading on that, so there will be a lot of activity and crossover.
Perfect. Thank you very much. Looks like we've got a plan then. So, thank you. Councillor Roberts, thank you.
Well, I have to say that I like the report, obviously, and I really like the conversation we're having. You've got older people that we focus on because they're not active, but I think some young children are less active than some old people. And I've been thinking a lot about this, and I think it's not just challenging people to do something and having somebody there to encourage them, but they've got to feel safe. We've got to make our area, our communities safe, and I love the idea of taking all this to the community. They deserve it. I'll give you an example of, we've got the Hanwood Park, the urban extension, and if we can get this right and be a strategic partner, when they've got money to spend, if they want to spend it on a facility, say a five-a-side football facility, they could make the footpaths, the cycleways, what I'm saying is the Grange Community Centre could be within walking, riding distance of the Hanwood Park, and we could then spend the money on the sport as opposed to on building that facility. It's already there. We could perhaps do something to it and give it a sort of a send-off. I just feel that it's just pouring out. I've got loads of notes, so I'll stop there. But I just think this is it. We've got to get on with doing this. And I've always said there's enough money, it's in the wrong place. We do have to come together. I like the conversations that are taking place where we're going to challenge ourselves that this is important. I mean, I will just finish on Wicksteeds Park sits in the heart of a revitalise, spent millions on it. We need to get some payback for our community so they can see the point of having all that money spent on there. We know why we want to do it, but they've got to have, the boardwalk's got to work, it's not got to keep flooding every year, and etc, etc, etc. Grays Field in Barton Seagrave is a sports an open green open space. It's owned by the council, but I think the parish council is going to get actively involved. But if things were happening on there, and then just down the road there's some open space, nothing ever happens on it. If we can see council activity, we're leading, we step back then and they take over, and they'll do better than we do. But I want to see us do partnerships like Grange and Hanwood Park. Why not? Sorry,
Yeah.
Chair.
I'll let Kerry. No, not at all. I'll let Kerry. But I know there's an awful lot of work going on behind the scenes here, so she can fill you in on that.
Yeah. So certainly the conversation with developers linked to communities, leisure, physical activities, an absolutely live one. And I know Julie, myself, and other colleagues are having regular conversations with Hanwood Park, with Stanton Cross, with Glenvale, thinking about the Corby developments that are coming on stream as well, and having, really being clear about what, now that we've got the draft strategies, what those strategies, the evidence base is, so that we can really steer the developers about what is needed in those new developments, so actually on site in terms of community and leisure facilities and pitches, but also that connectivity to what exists already in the vicinity. So there is absolutely live conversations about how we connect the green patch, for example, up with Hanwood Park.
Absolutely.
So that's ongoing. It's not always easy having those conversations with developers, because it's, obviously in planning terms you have to make it all fit, and then obviously viability comes into it. But we are probably more actively engaged than we ever thought we would be in those conversations. So it is positive, and you're absolutely right about it came up earlier about lots of facilities that probably are underused in our villages, in our more rural communities, or in our suburbs, and we want to engage with, whether that's town or parish councils, or whether it's other community groups that are active in on running those facilities or involved in those facilities, to see how we can get them in use. Now, we haven't really got the council resource to be delivering everything everywhere on every piece of ground, because we don't have that amount of resource, but we definitely have an enabling function, and we need to support people in those communities, whether that's through volunteering or setting up a new activity. We've got a new sports club network, we've got all the work that we can do with our voluntary sector partners to enable and support local people to set up new groups, activities, projects, initiatives. And that's our key role, is as an enabler and a facilitator, as well as obviously doing what we can do around delivery.
Yeah, on that, sorry, Julie, did you want to mention you've had some meetings with the Sports Club Network and that, haven't you? Which is the network I'm thinking of?
Sports Network.
Yeah, the Sports Network. Yeah, thank you.
Yeah, we have a North Northamptonshire Sports Network, so that's we've got over 110 clubs as part of that across North Northamptonshire. So we work quite closely with them to help build their capacity, to support them with their training and development. And they support us as well when we run our fun days or our events across North Northants throughout the year. They come and have a stand there, put free activities on, and to talk to people and try and get people actively involved in the work they're doing. And they are very sort of community focused and go into communities that need them. So yeah.
Yeah, the Active Family Fun Days, so we run those across the whole of the Northamptonshire through the main towns, and they've been extremely popular. We've had thousands of children attend, and it started off in Corby, but obviously when something works, that's what we want to do. We want to take it in and around the rest of the district so that everybody can benefit from those things. And it's been a real success, hasn't it, Julie? Yeah, fantastic days. And just seeing the children there, it's absolutely free. So, you know, they can go along and enjoy and learn about all the things that are on offer there, because it gets the kids, their grandparents, their parents, everybody out to have a look as well. So they've been a fantastic benefit, haven't they? And we're just going to carry on extending that as much as we can and work. Hopefully we're going to start trying to work with town and parishes to see if they're able to sort of join in the scheme as well. I think that's a desire.
Could I just say, Chair,
yeah.
It's taking back our public space. Mm. It's making it safe. It's mixing and matching different communities, and that's important.
Absolutely.
We've got to start getting this right, or else we'll have these little ghetto-y places where they're deprived. It's wrong. The only way we can do is bring them up from where they are and then welcome them into the family, the larger family.
Yeah, well, when positive activity happens in those public space, it breeds positivity, doesn't
Absolutely.
It? So you're absolutely right. Thank you. So, Julie, did you want to come back on that? Thank you.
Yeah, I was just going to mention as well about the fun days, but this year obviously we had the Olympics happen, so we have an I Can, You Can, We Can campaign that we run every year, and this year we had a couple of events linked with the Olympics and Paralympics. We had an event at Rushden Lakes where local clubs came along, and we had a similar type ethos where they talk to people, try and get people involved. I know the gymnastics club had something like 45 people join their club after that one day at Rushden Lakes. So if we can do more of those things across the Northants, that just helps encourage people to know what's going on in their local community and then be part of it as well. So yeah, we want to roll that sort of programme out too.
Yeah, it's all about promoting and working collaboratively, I think. So and we're doing it quite well, I would suggest. So, Councillor Marks, thank you.
Yes, thank you, Madam Chairman. I mean, on Avondale Grange, there has already been work to try and break down the psychological barrier of Stamford Road. Stamford Road is not the Atlantic Ocean. There's facilities on both sides of Stamford Road, but depending on where people live, they don't use the facilities on the other side of the road, which is potty. But there has been working on that to break down that, which is a psychological barrier, not really a physical barrier. On Hamwood Park and the Green Patch, it's good that there are going to be footpaths between the two. And it's also good there isn't going to be a road shoved through the Green Patch. That's something to be celebrated. On Wicksteed Park, I have to declare an interest from years ago. Used to be my employer, hasn't been since COVID. So when they made us all redundant, so it's no longer a financial interest. But there was a very, very silly little thing, which was that the path that was referred to, which floods, was flat. Even in the Neolithic period, people realised that a path should be curved so that water runs off it, but for some reason the path round the lake was made flat. I believe work is being done on that, but we will catch up with the Stone Age eventually.
It's amusing, but it's a point well made, and I think as we obviously, because I'm involved in delivering the Greenway as well, and we had a meeting last week, and it's really again quite encouraging to see all the work that's going on around trying to connect places up. But yeah, the design of those paths is absolutely critical moving forward, both in terms of safety and lighting, but also so that we can, because we know this county floods. Who knew? I didn't know Northamptonshire flooded quite so much when I moved here, but I've learnt the hard way.
Yes, thank you. Yes, no, you're absolutely right. And also it's not just about, making sure that the right surface is down. It's about maintaining those sort of things, and having maintenance programs and schedules built in from the get-go rather than having to think about it as an afterthought, you know. And I think that's part and parcel of what we're trying to do here is, especially with the Greenway that we're looking at, you know, everything we're doing now, although there are areas that are already developed and maybe haven't got maintenance scheduling, we're trying to work with our maintenance people and landowners to schedule that in. But anything new, it's got to be built in from the start. So we are trying to think outside of the box all the time to see what other things would have an impact and put barriers in place to stop people using these facilities. So yeah, thank you. Any further questions or comments from anybody? Indeed, yes, John, please. Thank you.
Can I ask a question on, I believe golf is a very important thing, and we have an excellent one in Corby. Do we have any subsidies for young people or training, or is anything happening that will encourage young people in there? Because golf goes up and down, it can be popular, it can't be, etc. Do we have any subsidies going for young people's memberships, etc., encouraging them?
Okay, we do have the Junior Leisure Club in Corby, which incorporates the golf course as well. So it's £14 a month, I think, at the moment. So I think it does go up in April next year, but only slightly. But that does give access for young people to access the Priors Hall golf course. It is an 18-hole golf course, which is quite difficult for young people to be able to use. So one of the proposals that we're working up at the moment is looking at a golf simulator development on site. So we're proposing at the moment that we have 2 golf simulators on there, so young people would be able to access that and virtually play any golf course in the world. So it's getting towards the end of those stages, so hopefully we will progress that and get funding allocated to build that, which will help build sustainability for young people coming into the golf course. We'll be able to do coaching sessions in there, have a golf professional, which will help feed the members from a younger age right through onto the full membership, and obviously give them the skills and the knowledge to be able to use the full course. And for those people who have accessibility issues or disability issues that can't use our course in the winter because it's very boggy, they'll be able to use that all year round as well. So it will open up a lot of avenues, a lot of doors for us, and help generate income to help sustain the golf course through the winter period as well. So that's something we're quite keen to develop, and develop a junior membership and junior coaching sessions to feed those young people through.
Yeah, it's quite exciting actually. We're just waiting to get it finalised, and then hopefully it'll be all green light and away we go. So yeah, there's a lot of these sort of plans in process, if you know what I mean. Don't say thank you, David. Thank you.
I just wonder if there's something that we could be a little bit more targeted around that. We've talked about the left behind communities, and we could potentially be offering opportunities to the local schools to come and have tester days, trial days and things like that. So even if it's just, your really quiet days, play 3 holes, play a par 5, a par 4 and a par 3, and yeah.
Yeah, I mean, that's especially when we've got the simulator there as well. It just creates that interest and excitement for the sport as well. But we do work with the School Sports Partnership, and they do hold some days at the golf course and bring schools along to have a bit of a go at that. But yeah, definitely more room to expand that and encourage more people to use it.
Thank you. Yeah.
It just says, yeah, it's a very challenging course. Even I've had to get a battery operated one.
I've seen it and I've walked some of it, but I've not actually played on it. And you wouldn't want to see me play. I tried once and I couldn't even hit the ball. So yes, I gave up after about an hour of not getting it absolutely anywhere. So yes, all credit to you if you can do it. Thank you. Right. Fantastic. I think thank you very much to everybody in the team. I must say, it's a pleasure for me to have such a fantastic team looking after all these facilities and everything that we have. They do an amazing job. I see them in action all the time, and I'm in absolute awe of the work that they do. They really, really do champion everything we do as an authority. And as I say, it is a privilege to work with them. So, yeah, thank you, everyone of the team as well. So the passion when we're out and about and doing the active fun days and everything, it's just an absolute joy. So, yeah, brings tears to my eyes. There we go. Thank you. I shall move on now. Thank you very much. Yes, thank you, Councillor Robert. Just has to leave the room for a moment. So the next item on the agenda is the Executive Forward Plan, which is December 24 to March 25. I think we're just looking at that to see if there's anything that we need to consider coming forward into this EAP. So if you've had a look, I don't think there's anything from my area, but David, Shirley, anybody? I think we're... Have you seen it, Kerry? I think we've got... Oh, we've got the pitch and track, but that's coming in December. But that'll be too late for the next one. Yeah, January. So, what have I got coming? So the Active Community Strategic Framework will be coming to the Executive on the 16th of January. So there will be, hopefully we'll have finalised the playing pitch strategy and the facility strategy then, and have an outline as to sort of action plans and things moving forward as well with that. So
I mean, I think the only thing I would say, Chair, on that, recognising that we couldn't bring those two strategies today, whilst the strategies will go to executive to adopt, hopefully, the delivery is very fluid and iterative. So more than happy to have conversations here about how we continually develop, assess, monitor those action plans and the delivery moving forward. The strategies are the strategies, but it's what we do with them that's more important.
Absolutely. Absolutely. Thank you. David?
I'm wondering if, so looking at March, there's quite a bit planned to go to executive that might be more appropriate for this EAP. So you've got the Wellingborough and Rushton area local cycling and walking infrastructure plan, health and wellbeing board strategy, going at that point as well.
Isn't that under Binley? Yeah, so the Wellingborough and Rushton area local cycling walking infrastructure plan, I definitely think we should bring that in, maybe look how it fits in with the Greenway, what we're trying to achieve on that as well, I think. Yeah. Okay, does anybody have any further comments or think that there's anything? Sorry.
So the only other thing, I think sorry.
No, carry on.
I mentioned bringing forward for January's EAP is that we are currently working on our cultural strategy.
Oh, yes, of course.
Whilst we won't have the strategy at that point, we'll have the findings from the initial stakeholder engagement. So I think that's on plan to bring that here in at the end of January. It's not on the forward plan specifically for executive yet, because we're not quite sure when it will be ready as a final strategy. So it might have to go out for consultation.
Yeah, but it'd be good to bring it to this EAP so we can talk about that. I know we're going to do quite a bit of engagement anyway. We're going to do a member engagement on that because obviously we want feedback on what our members think culture and is and what we want. And also we're doing a wider engagement with the stakeholders and public. So it'll be interesting to see what comes back from that, and that we'll be able to engage with that. Was there anything further? Sorry, Councillor McKay.
I had a look through the forward plan and it was very little for our area, but there is the health and wellbeing board strategy for North Northamptonshire. That would be extremely interesting to come here, so we may have an input into that.
Thank you, Shirley.
Yeah, that's going to the Health and Wellbeing Board in December. So, yeah, absolutely. We'd be more than happy to bring that here. And, because the implementation plans obviously will follow.
Absolutely. That's great. Thank you very much. Okay, so if there's nothing else on that, do you look like you're about to push your button, David?
Yeah, we've got two agenda items which are quite similar. We've got the executive forward plan, but then we've got the forward EAP's forward list of ideas. And I can see you're penciled in for Kerry for an update on the North ICS Place programme. So potentially, and that's for January as well, so potentially we could end up with 3 really good items for January around a health and wellbeing board strategy, an update on the place development
and the cultural strategy. Yeah. Yes.
I mean, we don't want meetings to last forever, but we do get the papers beforehand and we'll read through them. We don't need a whole, rundown before it. We should be able to get a briefing and then into questions and stuff.
Yeah, come prepared. That would be lovely. So really, we've sort of ticked off both 5 and 6. So if everyone's happy. Okay, well, with that, thank you ever so much for your input. I mean, obviously, it is valuable. We do gain a lot from bringing these papers here today, and I'm hoping that you get a lot out of it and get more understanding as to what the service is doing. So, yeah, so thank you very much. With that, everybody, I'm going to close the meeting. Thank you. Are we clear? No.